Hello everyone and welcome to Module 10. This week we will be focused on the topic of mental health. So with that being said, we are focused only on one chapter, and that is going to be chapter 58 in its entirety. So this is a pretty full chapter, so we're going to go ahead and just jump right in and get started. So what is mental health? That's kind of the first thing that we need to answer in this subject. So mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps to determine how we handle stress related to others and make our choices. Mental health is an important factor at every stage of life, from childhood to adolescence through adulthood. Realizing that people are more than just physical beings, you must be able to care for them as a whole in a holistic fashion instead of just what's on the surface. So with mental health, this will focus on the science of behavior of the human thought process, or psychology. A psychologist is one who actually is trained in the methods of psychological analysis, therapy, and research. A psychiatrist is a medical doctor who is chosen to specialize in the psychiatric field and can prescribe medications. Psychiatry is a branch of medicine that deals with the diagnosis, treatment, and the prevention of mental disorders. Regardless of what branch the provider is in, within the study of psychology, a distinction is made between abnormal and normal behaviors. So now let's spend some time discussing the different psychological disorders. Those are disorders that can relate from genetic abnormalities, infections, nutritional deficits, brain defects or injuries, and or substance abuse. Mental health disorders are identified as a behavior or emotional state that causes an individual great suffering or worry. It is self-defeating and self-destructive, or it disrupts the person's day-to-day relationships. The first one we look at is anxiety disorders. This is an emotional disturbance that impairs judgment. Those suffering from this disorder are able to tell the difference between fantasy and reality, but frequently experience vague feelings of apprehension, worry, uneasiness, or dread. This fear can prevent people from seeking needed help or treatment and can impair their overall health. Cognitive disorders are types of disorders that include delirium and dementia, and they impair the ability to think clearly. Delirium can be transient and is usually treated by easing the person into a withdrawal form of a substance or by treating the underlying cause. Now, dementia is something that we have talked at great length in previous courses, as well as previously within this course. So I'm not really going to discuss it here in the video, but you are more than welcome to look that up. Next, we have developmental delays. These will appear typically before the age of 18 and can be things such as Down syndrome. Mental retardation is a broad term used to identify individuals who are profoundly unable to function in the world and see those who have relatively high intelligence but are slow to learn. For example, this could be autism or Asperger's, where autism is a range of symptoms that generally include difficulties with communication and forming relationships. With these disorders, as the medical assistant, you need to work both with the caregiver and the patient. Never neglect your patient. Dissociative disorders are those that cause a person to withdraw from reality and disassociate or separate themselves from the life issues that give them anxiety. Amnesia also falls under this type of disorder because you will forget events, places, or maybe even their own ability to identify themselves. DID, or dissociative identity disorder, was formerly called multiple personality disorders, is a severe dissociative disorder where the person develops multiple personalities. Typically, these are due to the individual experiencing some severe victimization, and they develop these personalities as a defense mechanism. Next, we have eating disorders. This could be anorexia or bulimia. These are emotional disorders that affect primarily young women, but they can also develop in men. And what happens is they get a developed distorted self-image. These disorders are life-threatening and can cause permanent damage. We also have hypochondria, which is a disorder in which a person is preoccupied by fear or fears of contracting a serious disease. Now, typically, this is based on a misinterpretation of one or more body signs or symptoms. Impulse control disorders are a prime example would be somebody with ADHD or ADD, so attention deficit hyperactivity disorder or just attention deficit disorder. This disorder is an impulse control that affects many children and can persist into adulthood. Mood disorders are disorders of the emotions or feelings and are often included in persuasively negative worldviews. Bipolar is a prime example where the patient experiences what we call two poles, either mania or a high, or depression, which is a low. Mania is excessive energy, flights of ideas, enthusiasm. They typically have weight loss and lack of cognitive focus, where depression is a lack of enjoyment in life's usual pleasures such as food, sex, friends, family, hobbies, and they can be life-threatening when accompanied with suicidal thoughts. Then we have our last three here. We have personality disorders. These include narcissistic or self-centeredness. They can be paranoid or have abnormal concerns that people will hurt them. Antisocial behaviors, which is not concerned about the laws or other people. Histrionic or dramatic and borderline impulsive behaviors. Psychotic disorders are severe mental disorders that interfere with the individual's perception of reality and their ability to cope with demands of daily living. Schizophrenia is the #1 psychotic disorder that falls into this category, and that is marked by a variety of symptoms including delusions, hallucinations, disorganized and incoherent speech, severe or emotional abnormalities, and withdrawal into an inner world. And finally, substance abuse. Addiction is a psychological need for a substance that in its absence will cause withdrawal symptoms. When a patient is on a substance and depends on that substance instead of its family or friends to cope with problems, the patient is considered dependent on that substance. Treatment usually begins with the patient admitting that they have a problem and that the substance is controlling them and recognizing their need for help. From there, the patient is accountable for group therapy that the medical assistant may need to set up. So now, after learning all of these disabilities and disorders, it's important to know what are the treatment options. So treatment for mental disorders are varied and include psychotherapy, psychopharmacology, electroconvulsive therapy, and transcranial magnetic stimulation. Psychotherapy is a method for treating mental disorders by mental rather than physical means. This includes psychoanalysis, humanistic therapies, and family and group therapy. It also uses cognitive behavioral therapy to help change both the way that the patient thinks and how they act. Psychopharmacology is a study of the effects of drugs on the mind and the brain, particularly the use of drugs in treating of mental disorders. Electroconvulsive therapy is a procedure used for cases of prolonged major depression. It is extremely controversial as the electrodes are placed on one or both sides of the head and an electric current is briefly turned on, causing a compulsive seizure. So if you've ever seen A Clockwork Orange, they did this kind of therapy on the main character. Transcranial magnetic stimulation is a non-invasive procedure that causes depolarization and hyperpolarization of the nerves in the brain. This electromagnetic induction to induce a weak electrical current that rapidly changes the magnetic field in the brain. Now, as a medical assistant, you're not going to actually be performing these, but it's important that you know what those are and how to set up any treatments that the patient may need, whether that be to a psychiatrist or a psychologist. Next, we want to talk about the developmental stages of the life cycle. This will really help you, as the medical assistant, provide appropriate care for your patients. And there are 5 main stages to these developmental areas. You have the prenatal period, which is the first period of a child's development and covers conception through birth. Infancy, which is the second period, and it's a period of vast changes that occur from childhood through toddlerhood. Childhood is broken up into 2 periods. It's either ages 3 to 5 or 6 to 11. Adolescence is again broken down into 2 categories. They typically go from 12 to 14. We consider those early adolescence, and 15 to 19, which is late adolescence. Then the final one is adulthood, which is then broken into 3 stages. Early, which is the patients in their 20s to 30s. Middle is 40s to 50s, and late is considered 60s until death. Each of these stages will have different challenges, which I'm going to leave for you to read throughout your book. And the last thing I want to talk about is Maslow's hierarchy of needs. So what this means is that people have special needs and have moved through various levels in achieving satisfaction in their own life. There are 5 elements to this hierarchy of needs. Level 1 is typically the physical needs, okay, or psychological needs. That's typically food, water, and shelter. The second level is what we call security and safety. This is when the patient needs physical safety as well as security relating to their job or their employment. Level 3 is love and social needs. This includes having a sense of belonging to a group and the need for social interactions. Level 4 is self-esteem or status. This includes having a sense of self-worth and pride. And the 5th and final stage is self-actualization and self-fulfillment. This occurs when the individual achieves all that he or she is capable of achieving and experiences a sense of accomplishment. Now, the chapter does go on to discuss more things such as hereditary, environmental, and cultural influences on your behavior. This looks at how things like, certain environmental things will affect your influence on your behavior. It will discuss things like biases, prejudices, and stereotyping. I'm going to leave the rest of the chapter to you to actually read on your own, and hopefully you do that so you get a better understanding not only for your discussion board this week, but also your quiz in your lab course. Now for this week, you only have 1 discussion post, and that is your only assignment for the week. You will be given a list of mental health disorders in your discussion post topic. You need to choose one of those disorders and describe the disorder, its common symptoms, the possible causes, and the types of treatment that would or could be used. Now beyond that, you will need to locate one online or local support group that could be used as a supportive information during a patient education session. Your initial discussion post will be due no later than Tuesday, September 5th by midnight, and you need to reply to at least 1 classmate no later than Saturday, September 9th by midnight. Alright guys, that is all I have for you for Module 10 in our mental health chapter. If you do have any questions or concerns, please make sure that you are reaching out to me. I will be glad to answer any emails or phone calls that come through about anything from the chapter this week or anything that you have questions on. If you need my direct number to the Rockford campus, it can be found on your course homepage in the top right-hand corner next to my photo. Have a wonderful week 10, guys, and you've got 1 week left. Keep driving it hard. Bye, guys.